a little challenging because there's just some things that are just completely out of our hands. The other thing is I want people to really have a general understanding of what will happen and what should happen when your vet evaluates your horse for colic. And then to understand what happens if, God forbid, your horse has to come here to the hospital for treatment. That's something nobody wants to happen. And unfortunately, I love my job, but nobody really ever wants to meet me because I'm usually meeting you when your horse is sick. But I want to make sure that, you know, when we leave here today, you have a better understanding of what will happen and maybe ease some of your fears. And then finally, colic surgery is also a really scary topic. So I wanted to make sure everyone knows why that might be recommended, what the postoperative care entails. And then that, you know, there are definitely horses that undergo colic surgery and have great outcomes. And so it's not as an awful thing as we might think. Okay. And, you know, before we get into it, I just thought I might share with you how I even got here, because I know not many of you probably know me. Hopefully you haven't met me here. But anyway, I started off as a little kid, obsessed with horses in Connecticut. And so by the age of 6, I was riding at this farm down the road from my house. And so started off in a little boarding facility, riding hunter jumper in Connecticut. And it was a really small barn, and our trainer was tough. We did everything ourselves. So it wasn't, you know, like anybody was tacking horses up for me and all of that. So I got a really good life experience at that farm. I then went on to UConn for undergrad and then made my way across to Oklahoma State for vet school. Went to U of I, where I did an internship before coming to Georgia, but that was a pretty important stop on my path because that's where I met my husband, who is also a veterinarian and an equine podiatrist in particular. And then came here for a medicine residency, so specialty training in internal medicine, and I never left. So I did my PhD here, was board certified in internal medicine through this program, and now get the honor and privilege to teach veterinary students and to take care of horses in our area. So, and other large animals sometimes as well. And then I've got some children now. Only 2 of them are pictured here with one for their furry little mini, but you know, we are very blessed to be here and enjoy Georgia. So I won't be going back to Connecticut except for visiting family. And then just as a little aside, the research I did for my PhD was actually examining horses with colic that had to go to colic surgery, and specifically seeing how that affected cardiac function. So I spent a lot of time with horses preoperatively and postoperatively, like very intimately, for quite a few years while I was collecting that data. So that's a little bit about where I've been and how I got here. And so now we can kind of get into the meat and potatoes of this talk, which is about colic. And so what you guys might realize is that colic is, you know, probably the most common equine emergency. And the definition is truly just the horse's demonstration of abdominal pain. But it doesn't always mean that there's a gastrointestinal cause of that pain. That is the most common source, but there's also non-gastrointestinal causes. So horses that have severe pneumonia and pleural pain can present like a colicky behavior. Horses that have renal pain or liver dysfunction can sometimes look like a colic as well. And so we don't always know right away from their, you know, their clinical signs or their demonstration of the pain, what exactly is causing that discomfort and abnormal behavior. And then there's some behavioral causes as well. But for this talk, we're really going to focus on gastrointestinal causes, because by and large, that's going to be the most common reason why horses are not quite right. And it's also, you know, the most common reason they would end up being referred into the hospital.
And Dr. Beasley, I will go ahead and say for everybody, if you have a question, don't hesitate to either unmute or you can type it in the chat box. I will be monitoring the chat box. And so if you have a question, type it in and we will hopefully get it addressed.
Yeah, absolutely. I'm happy for you guys to speak up at the time. So it, instead of coming back later, if we have a burning question, let's be pretty, relaxed about this here for sure. So when we're thinking about things that actually cause abdominal pain in the horse, the mechanisms for that are really, really quite simple. So distension or stretch of receptors in the GI tract. So really usually gas distension within one part of the intestine. So either small intestine or colonic gas distension can cause discomfort. And that's typically pretty mild to moderate pain that would cause. And then another kind of mechanism for pain would be tension or something that was pulling in an abnormal way within the abdomen. An example of that is when a horse maybe has an impaction or a displacement, and the way the intestine is sitting in the abdomen is pulling on the attachments to the GI tract in an abnormal way. And then we get a little bit more severe pain when there's loss of blood supply or ischemia. And I'm going to say much more severe pain rather than a little more pain. These horses can be excruciating painful and throwing themselves down on the ground. And when we're talking about loss of blood supply, we're typically talking about something that's twisted. So we kind of call that a strangulating obstruction, where part of the intestine, could be colon, could be small intestine, is actually twisted off, and that affects how the blood supply feeds that part of the intestine. And then finally, there's another category of simply inflammation and or ulceration that results in pain. And so the GI tract might not be distended, it might not be pulling at all, but just inflammation on the lumen side, so the lining of the intestine, can cause severe pain. And those horses are typically ones that have, colitis, enteritis, and then sometimes severe gastric ulceration can make them very painful as well. So the circle around these four bottom things are just highlighting the most severe pain is when you have loss of blood supply or severe inflammation to some part of the GI tract. Okay, so we're going to get started with our first myth to bust. And I always hear that people say, it can't be colic. He just passed manure. He just pooped. And it's true that passing manure is important, and that is definitely usually a very good sign. But the horse's GI tract is extensive. And so when we look at the GI tract, this is just going to be the first part, and we'll see kind of the route of feed as it goes down the esophagus into the stomach, and then into the first section of the small intestine, which is the duodenum. It then moves through like 70 feet of small intestine. That's all hanging from the connective tissue and vessels called the mesentery, and then kind of works its way around to the ileum, which is the terminal portion of the small intestine that brings food and fluid into the large intestine. And the first part of that is the cecum. And so we're going to move on to the next slide, which looks more at the hindgut. So that was all the first part of the GI tract, stomach and small intestine. And that in itself is extensive. So the stomach can kind of routinely hold about 10 liters comfortably. And then you've got that 70 feet plus of small intestine. But then we have this vast hindgut. So the cecum is the first segment of that fermentation chamber or the hindgut. And then we have the large intestine that is also very extensive and was a little bit strangely made because the ingesta or the feed has to leave the cecum, and it goes kind of ventrally along the ventral colon all the way around to the pelvic flexure way in the back, where it then has to go up against gravity through a very smaller narrow segment called the pelvic flexure, and then back around again. And we'll see that a little bit better here. So this is that ventral colon where food and fluid is going through first, and then this pelvic flexure, which is smaller and narrower and against gravity up and around. And then from that dorsal colon, the ingesta goes across to your small colon, which is where all your fecal balls are made, okay? And so that is a prime spot here for impaction colics because there's a change in the diameter or the size of the colon, and food has to move in a weird way up against gravity. And so if things are dry, it's a really common place to get an impaction. This hindgut can hold 25 to 36 gallons of fluid and ingesta, which is absolutely massive. So basically it's filling this garbage can. So if the horse is colicking, it has a lot of reserves. And so it can actually pass quite a bit of manure as long as there's nothing that's blocking the road, from part of this colon into the small colon, okay? So it could have a problem in its small intestine, but all of this ingesta could still be sitting here and be ready to be passed. And so just because they pass manure doesn't mean they're not colicking. So that's our first myth busted. So kind of moving on to thinking about, well, how am I going to recognize my horse actually is colicking? What does it mean? It's really interesting. This group in the UK did an online questionnaire where they asked about 1,500 participants what they kind of knew about colic and how they would know if their horse was colicking and if it needed care. And there was all kinds of questions, but the things that came out of this particular paper were that about 45% of horse owners knew what a normal heart rate and respiratory rate should be. And about 2/3 of them knew what a normal temperature was, which I think is really good. And I think that's something we as horse owners are really good about taking and kind of knowing by heart. But what is actually normal? So for heart rate, a heart rate between 28 and 42 beats per minute at rest is normal. A respiratory rate of about 12 to 24 breaths per minute at rest is normal. And then the temperature usually is somewhere between 99 and 100.5. Technically, we're usually teaching students that if the temperature is over 100, then, or not over 100, over 101, then it's definitely a fever. But you know your horse best. And there are some horses that run at 98 all the time. And if they're 2 degrees over that, right around 100, that might be a fever for them. So anytime they're 100.5 or greater, we're suspicious that they might have a fever. And that's important because that knowing what that normal temperature is can really help you realize, if there's something making your horse ill. Most horses that are colicking don't necessarily have a fever unless they have an inflammatory cause or a colitis or enteritis as their cause of colic. Most of these owners knew that they should, monitor fecal output and try to listen to GI sounds, and that, the absence of GI sounds was not normal. But there was a real lack of consensus for when to call a vet. They couldn't really decide what and when the vet should be called. And it seemed that they were pretty modest at being able to detect when their horse had a surgical cause of colic. And the reason for that is the horses are usually very demonstrative in their signs of pain, but they were really poor at detecting impaction colic. And that's because those horses are usually much more mildly affected and they have less severe signs of pain. Okay. So really what the study highlighted was that we need better tools to educate owners and help them make decisions as to whether or not their horse needs to be seen by a vet and if their horse is colicking or not. So the AAP put out this nice little diagram of what are some common signs of colic. And I'm sure, well, I hope not many of you have seen your horses doing this, but the problem is some of these things, right, we see our horses do normally, like they'll turn their head toward their flank and bite a fly. But when they do it persistently and they do it in a way that they're not trying to itch themselves, or they are kicking at their bellies repeatedly and they have that kind of dull look in their eye. That's different than them being agitated because they're getting, attacked by flies. Pawing incessantly. Well, horses paw when they're impatient, right? They can paw on the cross ties as they're waiting to get out to be ridden. They can paw for food, but pawing and looking again, not for food, but just for either a place to lay down or pawing so incessantly would be a pretty common sign as well. We know that horses lie down every now and again, and that's totally fine. If they lie down comfortably to rest, they can even lie flat out to rest. But if they just can't get comfortable and they're repeatedly up and down or rolling, and what our rule of thumb is always is if they get down and roll and they get up and they don't shake, then they don't feel well. So rolling in the clean shavings or out on the grass or wherever, if they get up and they just kind of look dull, like they maybe want to go down again or just don't shake, that's a sign that particular rolling is associated with discomfort. So another really important sign that I think we see pretty often is actually leaving food behind. So not eating their normal ration, going to eat grain and then walking away from it, sticking their head in the water and just sitting there, or dunking their mouth repeatedly. Those are all signs that they are not feeling well. And you all know your own horses and are usually really quite good at picking up if they have that kind of listless expression, that sign that they're just not themselves. There are definitely other signs of colic as well, and some are still kind of mild, like stretching out, doing that downward dog kind of position, doing, repeatedly posturing or straining to urinate or pass manure. That's something we see a lot more in little young foals, but adult horses can do that as well. And then, severe signs or rolling repeatedly, can't keep them on their feet. And the one that gets me is if I see these superficial abrasions, especially over the eye or on kind of their temporal bone there, I'm always really worried that they had a really, really severe lesion that caused intense pain. And unfortunately, sometimes by the time we see those horses, they are standing quietly. They might have a very high heart rate, might be a little bit sick, but that usually tells me they were so painful at one point in time that they did not care about beating their head up on the ground or on the stall. And that is usually a sign of a strangulating lesion. So some part of the intestine flipped or lost its blood supply, because that is the most excruciating pain. And what happens as that intestine starts to die is that it starts to not feel bad anymore. So when you initially get that loss of blood supply, it's just awful. And then as the GI tract dies, and doesn't have that feeling anymore, they can actually stand there, not really overtly painful, but extremely dull, and usually still have a very high heart rate. So of course, other signs would be if they were completely covered in mud and dull and despondent. Okay, so they're not always actively throwing themselves down, but those can still be signs of severe colic. Okay. So you have decided now that you saw some of those signs, your horse is colicky, so now what do you do? Well, good rule of thumb is first, just remove food from your horse's stall. They're probably not wanting to eat it anyway, but pulling the feet out is a good move. Calling your vet to tell them what's going on and get some advice on what they should do next and figure out when they could be there. Taking the temperature is great, because getting a temperature on the horse before they've had an NSAID, an anti-inflammatory that could mask a fever, is important, because that can actually guide your veterinarian to knowing what the cause of the colic or the colicky behavior is. And taking other vital parameters, so other like respiratory rate, gastrointestinal sounds, or heart rate can also be helpful as well. You could have a little stethoscope to do that for the heart rate. You can feel the pulse on the face. Those are ways to try to get an idea of what the heart rate is. If you don't actually have a stethoscope, that's fine. And then think about, has there been anything that's changed recently? And usually it's changes to routine, diet, or management that might trigger a colic episode. What you shouldn't do, which is, something that's impressed upon all of us. I remember being told as a kid to walk colicky horses and did it incessantly, keep them up, is you don't need to walk them incessantly, because that can actually delay them getting where they need to be. And that is rarely going to resolve a colic that needs more attention. And we'll talk about, there's a few types of colic that might respond to a little bit of walking, but if they need walking for hours, it's not going to respond with that. We definitely want to give any medications that your veterinary said to go ahead and give, but don't give medications without the knowledge of your vet, and they'll let you know what the right amount of Banamine to give. Usually they can have you give either a little bit of Banamine paste by mouth, or even the injectable Banamine can be given orally, and that can help until the vet can get there. You don't want to give an enema or try to perform a rectal exam, and definitely don't want to give oil of any kind by mouth or try to tube the horse, because that could end up with oil in the lower airway or in the lungs, and that in and of itself could be fatal if it gets into the lungs. So really, we want to call the vet early, describe the signs that you're seeing, medicate with permission. And if your horse is just so painful or so sick appearing, like purple in its gums or really pale in its gums, or too painful to wait, you can always self-refer to a hospital. That's always an option. It's important to know what equine clinics are around you and know if they're staffed with emergency surgeons and anesthesiologists, and good to know before you go. So you don't want to be stuck in a situation where it's an emergency and then you're trying to figure out what is close to you and who can admit your horse. Okay. So another thing to think about is that actually signalment, so the age, breed, and sex of the horse kind of helps inform us what to think about when we're seeing colic signs. And of all those colic signs that we listed, some of the more mild ones actually could be signs of more severe pain in certain types of horses. And this is what I mean by that. So young horses are babies in a lot of ways, but they're babies in terms of how they tolerate pain. And so a little gas bubble could make them throw themselves on the ground and throw a temper tantrum. So their signs and the way they demonstrate pain is typically going to be more severe and over the top than older horses, especially notoriously stoic horses like stallions, draft horses, older horses, especially those that have equine Cushing's disease, which I have here listed as PPID, Tennessee walking horses. These are the notoriously stoic breeds. So a good example is, as a resident, I just remember this one Tennessee walking horse stallion. So double whammy, because he was a Tennessee walking horse and a stallion. And he, pretty normal physical, just barely pawing a little bit in his stall, and wouldn't paw if you were watching him. So you had to kind of sneak around and watch him, and he would just have a few paw marks in his stall. Well, he was sitting there with a strangulating lesion. So the small intestine had cut off its blood supply and was barely showing any signs at all. And it's because this is not a joke. These horses are really just extremely stoic because of their breeding. I think for stallions, you've got testosterone. Draft horses are just amazingly tough. And then these older horses that do have PPID, especially if they are not being treated, beta endorphin is actually one of the things that gets released from that overactive pituitary gland. And that's like a natural pain medication. So you've got those horses to remember that they might not look as colicky as that baby horse throwing itself on the ground, but their problem might be much more severe. And that's not really for you to know in terms of make a decision, but have in the back of your mind if you have one of those breeds. brood mares notoriously get colon volvuluses post-foaling. So they basically can flip their colon and cut off the blood supply to that following parturition, where they had this huge foal taking up a lot of space in their abdomen. Now they have an empty space, and the colon can get itself in some precarious situation. And that is a true emergency where you don't have a lot of time to act. And a colicky broodmare, especially just a day or so post-foaling, you want to rush to a hospital. So, in Kentucky, those horses that get colon volvuluses do really well because most of the big farms are 5 minutes away from the big hospitals in Lexington. And their outcomes are great because they can rapidly respond and get them into surgery really, really quick. The longer the intestine goes without blood, the worse the outcome. And that makes sense because you need, your organs need blood to survive. And so if it's not getting the blood supply it needs, then the colon is basically dying. Other interesting signalments that matter are miniature horses. They have an increased incidence of fecal liths, which are basically concretions of very, very dry manure beyond an impaction. They're literally rocks of poop. And sometimes those can be treated medically, but they often need to go to surgery for treatment. Horses that are 15 years and older are at increased risk of having strangulating lipomas. Lipoma is a fatty tumor that grows off the mesentery of the intestine and can kind of wrap itself around the intestine and strangulate the gut. And then Arabians are reported to have increased incidences of enteroliths, which are basically true rocks, so they're mineralized, and they form in the large colon and cause an obstruction and a ton of gas distension. Sometimes horses can pass a little bit of liquid around it, so they might look like a diarrhea. It's very painful and gas distended, but the only way to resolve those sorts of cases are with surgery. And certainly other breeds can get enteroliths as well. They're just overrepresented in Arabians.
So to do that, how would you see that in an exam, or would that be presented when it's almost too late?
So it's a really good question. And we'll talk a little bit about what the workup entails. But yes, when you're doing a workup for colic and you're trying to decide what the cause is, for an enterolith, what you might feel is basically just a lot of gas distended large colon. It'd be rare to actually get lucky enough to feel the stone. You can sometimes feel it if it's in the transverse colon as it leaves the large intestine, but we can take x-rays if we suspect it and see that stone on an x-ray.
What's the largest one that you've seen?
Probably like, I don't know, like a big grapefruit, I guess, like that. And sometimes there's more than one. So they'll often have like little like triangular shapes and things like that. And sometimes there is something in the middle of them, like a nidus. So a couple of examples are a horse that swallowed like baling twine, and the stone kind of formed around that. But a lot of the times there's nothing in the middle. It's just a concretion that has to do with basically diet. Increased alfalfa seems to be related to enterolith formation, and then just kind of location. So they're more common in horses that live in California than here, but we definitely see them in Georgia as well, even in horses that have never been to California. So, okay. Anyway, we'll get on to a little bit more about some other historical findings that we are, kind of ask questions about and be thinking about when we're trying to sort out, what kind of colic might be going on here. But you'll always get asked a question about diet and housing changes. So have there been any changes? And this could be even as small as a different person feeding than normal. And why would that be? Well, it might be that they are a little bit heavier on how much hay they give, or maybe they, didn't recheck the waters, or who knows, but not to point blame at all. It's just that little tiny changes in routine tend to make a difference. And there's going to be a lot of horses that are extremely tolerant of that, but it's just the perfect storm usually of there's a little change and something else probably going on in the horse's life that set up for colic in those situations. Cribbing and wind sucking, like this horse is doing on the fence here, there is an increased incidence of epiploic foramen entrapment. And what that means is that part of the small intestine works its way up between the liver and gets stuck and wedged in between part of the lobes of the liver towards the diaphragm. And so it can definitely cause a strangulating lesion of the small intestine and can be really difficult to diagnose because of the part of the intestine that's going through that area near the liver is really hard to see reached by rectal exam, hard to see with ultrasound sometimes until it's quite severe. But those horses are usually all of a sudden like drop like flies, acutely severely colicky, and time is of the essence if they go from being totally fine to so painful you can't keep them on their feet. Other changes that we see associated with different types of colic are feeding coastal Bermuda hay, especially if there's a recent change in the cutting or a new introduction of coastal hay to a horse that's never had it before. So we live in Georgia. Coastal hay is everywhere and it is a good hay. It is the rare horse that gets an ileal impaction. One of my own horses lived on coastal hay its whole life and never had a problem. But a horse that does get an ileal impaction associated with coastal hay might be one that you think about switching to a different hay or giving it, one strike, you're out. So if you do it again, you cannot get coastal hay anymore. But it's definitely possible if they've had that happen to them where they have a small intestinal impaction in that distal portion of the small intestine, the ileum, that they recover from it, and then they can successfully go back on Bermuda hay if that's all that we can get. Of course, horses with bad teeth are at increased risk for usually impaction colic because they're not masticating the food into short enough particles. So then as it gets into their GI tract, it's long and stemmy and fibrous, and is just a perfect way to kind of net up and cause an impaction. And so young horses that have caps in their teeth, young miniature horses that have too many teeth for their small mouth, they're at increased risk of impactions, as well as old horses that have just no occlusal surfaces left. They are at increased risk as well. And then if you're from coastal Carolinas or Florida, or sometimes even some areas around us, sand colic, it can be a problem as well. And horses generally aren't trying to eat sand, but as they're grazing or as they're eating hay off the ground, they can pick up a good bit of sand, and that is abrasive and can cause irritation to the lining of the large colon. And if there's enough of it, it can actually cause an impaction or really severe colitis. Okay, so myth number 2. If we just keep walking him, he'll be fine. And actually walking does work quite well if they have spasmodic or gas colic. So they kind of, get the GI tract, moving again and pass the gas. And spasmodic colic is probably the most common type of colic that we see. And we don't see it at Georgia because it's fixed in the field. So it's something that, your horse is better after you talk to your vet and give him that 1/2 of a dose of Banamine before the vet even gets there. He's better with a spasmodic type colic most of the time. So, early intervention improves outcome for sure. And when we're thinking about the types of colic, the majority of these cases, like I just mentioned, are going to be simple obstructions, spasmodic or gas colics that resolve with very minimal intervention, and they resolve quickly, meaning within hours to minutes. So that's basically usually a single dose of Banamine or a single dose of sedation from your veterinarian. But if there's multiple times that your vet needs to see them, or they're colicky after that initial round of sedation, then that usually indicates there's a more serious problem. So horses that have basically non-strangulating impactions or obstructions of their intestine, including displacements of the large colon, they can take sometimes days to resolve, and they require supportive care and really close monitoring. Most simple impactions are going to be better by the next day, after your vet comes out, does an exam, and maybe gives the horse some fluids. Okay. Horses that have strangulating lesions, so a twist of the intestine somewhere, that is a true emergency, and the longer the delay, the worse the outcome. And so the best way to be able to tell what it is by thinking about how severe the pain is that they're showing. So again, thinking about a horse that has spasmodic colic or displacement or an impaction is usually never painful enough that it's going to throw itself on the ground to the point where it's got abrasions and cuts and scrapes all over its head. And so thinking about that will help kind of you as an owner decide what the urgency is for that particular animal. So what you also want to know is, what should you really expect when your vet comes out to do an exam? What's actually happening in a colic exam, and why do we do these things? So the physical exam is crucial. That initial physical, looking at the heart rate, looking at perfusion parameters, meaning systemic blood flow to the whole body, is really important. So a horse that is got a simple type of colic, like an impaction, should not be severely dehydrated, should not have a very high heart rate, and shouldn't have cold extremities like they're in shock. So that first part of the exam is really looking at, do I have a stable patient or do I have a shocky patient? And getting an idea of the pain level, okay? Because pain is really important to deciding what sort of category of colic this horse is likely in. Then passing a nasogastric tube is really critical. And the reason for that is that horses cannot vomit. You probably all know that, but they can't, relieve their stomach if it's getting filled with fluid or food and getting backed up. So passing a nasogastric tube is critical, first off, as a diagnostic to find out, is there fluid building up on the stomach? Is the stomach so filled with feed that we're not able to get any ingesta or fluid back? Because actually horses can certainly fill fluid up in their stomach when they have an obstruction somewhere in the small intestine, but they can also get gastric impactions where the stomach is not able to empty appropriately and get so filled with feed that the stomach can rupture, and it can rupture spontaneously sometimes. So even with a nasogastric tube in place, it still is at risk of rupturing if it's very, very impacted. Luckily, gastric impactions are really not very common in adult horses, or I should say full-size horses. They're more common in miniature donkeys and miniature horses. The other thing that most veterinarians are going to do, if it's safe, is to perform palpation per rectum. And so they will do this if they can, but if the horse is throwing themselves on the ground, it might not be safe to do that. And in terms of the amount of information gained by a palpation per rectum versus some of the other parts of the exam, it's less important in some situations. It is still gives us very good information, and we're so limited in what we can do to examine the horse's abdomen and GI tract that it's putting all these pieces together to be able to make a diagnosis. And so when we feel per rectum, we're basically trying to see, can we feel an impaction? Can we feel just gas distension in the large intestine, or do we feel small intestinal distension? Because that can help us categorize, where along the GI tract is the problem. And then when we do that, when we're able to localize it to a certain part of the GI tract, then our list of potential causes for that area is very different and very specific. And that helps a lot trying to decide, how do we treat this particular animal? And then the next thing that is often done, even when the vet comes out to see the horse, is some amount of basic blood work. If it's a really simple colic, there might not be any reason to do blood work, especially if the horse is already better by the time the vet gets there. But basic blood work allows us to get a better assessment of hydration status, look for other causes that are not related to the GI tract. So is there evidence of liver disease or renal disease or something else that might be causing their signs? And then inflammatory causes as well. So is the white count very low or very high? And that would point to a different type of colic. So enteritis, where they might not have reflux yet, or colitis, where they're very painful, they don't feel very well, but might not have a ton of diarrhea at the onset of that disease. And then finally, a belly tap. So sampling the abdominal fluid is something that is not routinely done in the field and may be done from time to time, depending on, the discussion with the owner, with you guys, about whether or not the plan or the option would be to send the horse into the hospital or to keep it at the farm for treatment. And the belly tap really allows us to evaluate that fluid that's bathing the intestines to see if there's any indication that some of the intestines are compromised in terms of their blood supply. It also helps us diagnose another cause of colic that I didn't really talk about much here, but peritonitis, which is infection and inflammation within the peritoneal cavity, and requires a completely different treatment plan than most types of colic, because that often needs, broad spectrum antibiotic treatment and not usually surgical treatment, or even usually not associated with other problems within the intestines themselves. Okay, so this is a little bit of belly fluid collected, and it's an abnormal color. So normal color in the belly tap is straw colored yellow. It's really clear, you could see through it. The protein in that sample is low, the cell count is low, and it really should not have any evidence of red cells. And so this one you can see is kind of like kind of an ugly reddish orange color. And what happened in this particular sample is that red cells basically leaked out of some vessels that were damaged from a strangulation of the small intestine. And so that's one of our biggest clues that what's going on in the abdomen is something that will likely require surgical intervention. And we'll talk a little bit more about that in just a minute. So myth number 3 that I hear all the time, and my brother-in-law, who's a vet in Southern Illinois, hears is, oh gosh, I can't trailer in. They're not going to stay up on the trailer. They're so colicky. Well, if this is happening where they're so colicky that you're worried they're going to not stay up, then they really need to go if they're that painful. And actually, most horses do end up staying up on the trailer. There's ways to trailer them without worrying too much that they're going to get stuck. So ensuring, depending on what kind of trailer you have, you can sometimes leave them loose to ride, make sure they're not tied so they're not going to get their head stuck. But honestly, a lot of the time, you're going to get the vet to be out there to give them sedation, and they make it just fine on the trailer. And there is some truth to the fact that sometimes a trailer ride fixes everything. So especially for those horses that have some degree of probably a displacement of their large colon, sometimes jostling around on the trailer can kind of help work it out of the place that's stuck. And the best case scenario, it was so painful on the farm, and then you get the horse here and it's actually perfectly comfortable, the rectal exam's normal, and all we have to do is refeed it and send it home with you. So that's actually one of the best case scenarios that we could see. And that kind of leads us to like, what does happen if you have to come to a referral hospital? Something that probably no one wants to think about, but could happen. And so what will happen is really similar to what happens on the farm, but there'll be a lot more people, and there'll be a lot of more precautions to be able to keep your horse safe, because we're in a very controlled environment where we have stocks and people to hold and all kinds of really excellent help. So there will always be a attending veterinarian, so a board certified faculty member, a resident that might either be specializing in surgery or critical care or internal medicine, and then a rotating hospital intern that goes through rotations on surgery and medicine, and then final year vet students that are either on the medicine service or on the critical care service, will also be involved in, the exam, but they're not triaging the patients or doing any of the procedures. They're learning and watching ultrasound and hearing about what the rectal exam findings are. They're not doing that whole colic workup. And then we have registered veterinary technicians that are here to assist and help things like get blood going and all of that. Okay. The other thing that's really important is we're going to collect the history from you. And that is going to be important to kind of know all of those things we kind of chatted about before, about knowing the diet, if there's been any changes to anything, if what the horse normally does for a living, all of those things are really important. And then we're usually going to repeat most of what's done on the farm because, one, it can change. And then two, we have other tools that are way more accessible in an exam room than they are in the field. So transabdominal ultrasound becomes really important because we can evaluate the large intestine, small intestine diameter and thickness, the motility of the GI tract, the position of the stomach, a lot of things that can help us more specifically pinpoint a diagnosis. We will do an abdominocentesis if one hasn't already been done. And then also we have the opportunity to do radiographs or x-rays of the abdomen here. And those become really helpful in small patients where we can't safely do a palpation per rectum. They're very helpful in cases we suspect sand or an enterolith or a fecalith or something like that. And then basically, once those things are done, we're able to just hopefully come to a working diagnosis, like where's the problem, what do we think is going on, and how are we going to treat it? And this is typically, well, always done in terms of communicating with you by a veterinarian and not a student. A student might be with us to listen in on the conversation, but you're always going to be, addressed by one of the veterinarians here. Okay, so when would surgical intervention actually be recommended? So what are the things that we are thinking about when we're faced with, does this horse need to go to surgery? And this is not always a clear-cut answer, but the things that are clear are if there is persistent pain in the face of the horse having received pain medication, maybe even received pain medication on multiple occasions in a short period of time, those are reasons to go to surgery, because that severe of pain tells us that the lesion is probably something that needs surgical intervention. Might be that it's twisted, might be that it's really in an abnormal location with a lot of tension or gas distension. But that's by itself, even without really any other things, a reason to go to surgery. For sure, if the peritoneal fluid or that abdominal fluid is severely abnormal, where there's lots of red cells and the protein is increased, some indication that something isn't getting blood like it should, and that part of the intestines are at risk of dying, that's a reason to go to surgery. And then sometimes it's truly for diagnostic purposes. We can't really figure out the reason from the outside. The horse is either persistently painful, or every time we try to feed it, it can't tolerate being fed without getting colicky. Those are all reasons to go for an exploratory surgery. And when we're talking about an exploratory surgery and a colic surgery, it truly is, exploring the abdomen. So a ventral midline incision, and that allows the surgeons to access all of the GI structures that they possibly can, and it gives them the best ability to make a diagnosis and to fix the problem. Laparoscopy is sometimes an option for some types of colic, but we're very limited in what we can see with laparoscopy. So basically using portals and a scope to enter the flank of the horse and have a look around with a camera, but then there's not always a lot of options for being able to, fix part of the intestines if something needs to be physically moved out of a stuck spot, or actually run the intestines and see if there's a piece of intestine that needs to be resected or removed surgically. And so that's usually not a go-to, but there might be certain indications for laparoscopy in some horses. So if the worst comes down to thinking about, do we need to go to colic surgery? And what we often need to think about are what are the costs associated with this? Well, it turns out that kind of both types of management, when we come down to being in the hospital, can be quite expensive. And so for a simple medical problem that's basically going to respond to intravenous fluid therapy and pain medication, a usual estimate is somewhere between $2,500 and $4,000. For a complicated or sick horse that has fever and diarrhea or some of those inflammatory causes of colic, the estimate is usually much higher. So on the order of $5,000 to $10,000, and can go up from there. And then for surgical colics, for a simple colic surgery, and that's usually something like the colon is in the wrong location. It does have an enterolith and it just needs a simple enterotomy, which is just making a simple incision in part of the colon to remove the enterolith and then close that back up. Those are usually, we're given estimates of between $5,500 and $7,000. And then for more complicated cases where there's intestine that needs to be removed, that can be $10,000 to $12,000. And I just felt we had to talk a little bit about costs given the title of this talk. And that's really a rough estimate. And it's important to have those rough estimates because then you can kind of plan appropriately, if the worst ever does happen in your farm or with your horses. So another myth to dispel here is that, oh, my horse is just too old to go to surgery. And a lot of people think that age has a negative impact on the outcome or on the prognosis of the horse. But this is an example of a 34-year-old gelding right here, which this is a horse that I used to ride, and he really enjoyed getting his pergolide, but he looked amazing right up until he passed away. But definitely his age would not be anything that would preclude him from doing well under general anesthesia. And the same thing for this older mare. She's got a nice gray face, but her age alone doesn't mean she's at an increased risk for having complications with general anesthesia or with surgery in general. So age is not a key factor in prognosis for colic or for colic surgery. But what are some things to think about when you're trying to decide, is my horse a candidate for surgical management? And so the things that we think about and always warn owners about, what are the things that the horse has to go through to get through a colic surgery? And the big three hurdles are, one, general anesthesia and intraoperative risks. So there's always inherent risks of general anesthesia. There's about a 1% 1% of the population that undergoes general anesthesia has a poor outcome and can actually die in recovery. And that could be from breaking a limb or having cardiac arrest. But it's pretty small. It's not as small as in human medicine, but pretty low risk. And then there's, of course, what's happening in the abdomen. So intra-op, what is the lesion that's found? And it is possible that, the surgeons take the horse into colic surgery and they find something that does not have a good prognosis for long-term recovery. And in those situations, we don't just carry on. We always have a conversation with the owner to say, look, this is a lot worse than we were even expecting. We think the horse is going to have a hard time recovering and that the quality of life in the long term is pretty guarded. And so at that point in time, it's another place to say this might not be the best thing to carry on, and we can put the horse down while they're under general anesthesia and not try to go through the stress of recovering and the immediate postoperative period. So then the next hurdle is recovering from general anesthesia. You can see here that we have ropes to help them recover on their tail and on their halter, and that just helps steady them and sometimes give them a little boost with manpower a little bit if they are a little bit weak or wobbly, and just helps them stand there for a while. And then the big thing to think about in the immediate postoperative period is postoperative ileus. Incisional infections can occur. They're more likely to occur in horses that have colitis, so severe colic, colon inflammation, and or horses that have had 2 surgical events close by. So there are some horses that end up having to go back to surgery after the initial surgery, and that increases the incidence of incisional infections. And then adhesion formation, which just means that the intestines are sticking to some other part of either other parts of the intestines or somewhere else in the abdominal cavity that's not normal, and can impede how food and fluid moves through the intestines and how they can act normal in terms of motility. And that can cause either chronic colic issues, or in really severe cases could actually make them not able to eat appropriately, such that, they end up having to be euthanized at some point in time. But that risk of adhesion formation is really pretty low in colics that have large colon displacements. It's really those that have severe small intestinal lesions with a lot of inflammation and a longstanding lesion there that are at most risk for adhesion formation. And then the long-term postoperative period, we're really thinking about, what are the main things to worry about. There are some horses that deal with chronic colic where they colic every few months. That does not happen very commonly. And again, that's probably related to adhesion formation. And then what is good to know is that for most types of colic that end up having to go to colic surgery, the return to previous level of athletic use is quite high, and as high as 80 to 90%, especially in horses that have had a simple type of lesion at their colic surgery. So some sort of displacement or impaction that was resolved surgically.
Yeah, I saw a barrel horse who had colic surgery, and then he recovered so well. He came back and was back even better. He was beating arena records, and it was amazing.
Yeah, so it's right. It can be quite amazing. I've certainly had horses that were cut 3 times that ended up going back to jumping and doing outstanding. You don't want that. You don't want them to have to go back 3 times, but every horse is an individual also. And so we try to give these stats and talk about prognosis, but it doesn't always apply perfectly. And so it's really good to think about, your own individual, what your comfort level is with the financial risk, I guess, is important to think about. But they really can do beautifully and never look back. And that's the cool part. Things have really come a long way from when I was a little kid. So then if you do end up in the situation where your horse has gone to colic surgery or has come in and had medical colic, what you can expect will happen is, if the horse is coming home from a hospital stay, it will still need a few days of rest usually before it goes back to its normal routine. Our goal here is always to get it back onto as close as what is normal for its feeding routine in the hospital. And we know in the hospital, we can't ever really be normal, but we try to make sure it's getting the same amount of hay and feed and out for grass and those sorts of things. So there's not a big transition period when it goes home. And then for surgical care, we are basically trying to just wait for the incision to gain its full strength before we're going back to work under saddle. And that's where these 30 days of stall rest come in, 30 days of small paddock turnout without a buddy, so that way no one gets hurt. And then 30 days of normal paddock turnout with pasture mates before going back to work under saddle. And of course, it's important to go gradually back into work. One of our former interns is a surgeon now, so Dr. Tara Shearer, and she worked on this study with her mentors and looked at the effect of core abdominal muscle rehab exercises on the return to training and performance in horses that have had colic surgery. And these basically are able to help horses go back into work with less complications, more ready to, get right back at it. And it's just simple things that you can do on the ground, like little sternal lifts and things that can help improve the abdominal muscles so they're ready to be their best versions of themselves when they go back. And sometimes, like, you're saying, Ashley, they're even fitter and better after surgery. We always joke that, sometimes horses need a resection or partial colon resection. And I certainly had a couple polo horses that had that. And then they also commented that their horses were faster after that as well. Not a reason to have a colon resection, but it can be a positive thing. Here we have a horse that's sitting in a belly band, and this can help, especially if you've had a horse that's had more than one colic surgery, just provide additional support to that incision as it's healing. If we do get a horse that does have an incisional infection, it is not the end of the world. A lot of times the incisional infection does make them a little bit more of a risk to develop a hernia, but most hernias in horses with incisional infections are really small, don't affect their ability to go back to work, are not even that cosmetically off-putting, and really, don't limit them at all. And these belly bands tend to be really important in those horses that do have any incisional complications. So they're helpful as well. And I heard that you guys did have a gastric ulcer talk. So that is awesome. That is a big relief. I didn't know that before I did this, but I just wanted to briefly mention gastric ulcers because this is a cause of colic. It's usually associated with mild colic signs, but we do see some horses that have severe signs related to gastric ulcer disease. It's usually because their ulcers are very severe. They might be very deep, might be hemorrhagic. And so it is possible that, horses that are quite colicky have ulcers, but usually, again, not to the point where they're throwing themselves on the ground, can't pick up, can't keep them off the ground. The most common thing to see with these really severely affected horses are horses that go to eat, and as soon as they take a few bites, they just walk off and are starting to show their signs of colic almost immediately. So that would be a good indication that, oh, maybe this is related to ulcers if they just, start refusing pelleted feed and are still eating grass and hay really well, still passing lots of manure, or physically otherwise well. The other little thing I wanted to remind everyone is that omeprazole is the treatment of choice for most gastric ulcers, but it doesn't have an immediate effect. It has to be absorbed and then have an effect. And that usually takes at least 3 days to actually see any improvement in those clinical signs. So that was just a little brief word on gastric ulcers. So we're almost done here. I know that I'm probably taking too long, but I just wanted to talk about a few risk factors for abdominal pain in horses. And there's definitely a lot of interest in this because we all want to not deal with going to the hospital and not having horses colic. And they did this huge systematic review and basically showed that really changes in feed and recent change in housing were the things that stuck out as being related to an increased risk of colic in the adult horse. And so the things that we all learn and that we're all told all the time is keeping it simple and keeping things the same is actually kind of important. The other more recent study that came out in 2020 was that this group out of the University of Pennsylvania showed there was a lack of association between barometric pressure and the incidence of colic. And this was an ambulatory practice. They did, however, note that there was an increased incidence in fall, spring, and summer. So there might be some seasonality to colic, but very interestingly, there is no effect in barometric pressure, which we always think, oh, a storm is coming, horses are going to start colicking. And honestly, that seems true still, just from observation. The colic barn always seems fuller when we're having storm systems come through. So we're seriously almost done here, but I just wanted to have a few words about prevention. And the main things here are that consistency is the key. There's no magic bullet. There's no one thing that's going to prevent colic in all horses. Just knowing your horse, knowing what's normal for your horse is probably the most important thing. Know how much they tend to drink, what their normal manure frequency and consistency is. And there is actually some actual study that looked at bucket color preference of all things. And it seems like in pasture, horses preferred turquoise or light blue buckets over dark colors like red. And I think that's really interesting, really strange, but I'll say that I didn't even know about that study. And I was very like superstitious about bringing this tub that my horse drank out of from my old house to this new house that had really nice big water troughs, just in case they stopped drinking. So being consistent is key. It seemed that stalled horses had no preference for bucket color, but if you've got horses outside that aren't good drinkers, maybe consider getting a teal or blue bucket. But thinking about like what is actually normal, how much do horses need to drink is important. And the average like 1,100 pound horse really should be drinking about 25 liters a day. And that's mostly like a bucket and a quarter per day is normal. And they can certainly drink more than that in certain times, depending on the weather, depending on their exercise level. Lactating mares need to drink a lot more than that to support foals. So it's really diet and activity level as well, dependent as well. Horses out on grass are not going to drink as much as horses primarily eating hay. So that also becomes a factor. And then again, keeping things consistent, trying to avoid sand if you have a sandy area, trying not to feed them on the ground. Cribbing collars and other deterrents for cribbing become important. And then if you do feed coastal Bermuda hay, that again is usually very well tolerated. It's just making changes gradually if there's a new batch or a new round bale or something like that. I guess what would be most important is putting a new round bale in before the old round bale's too much gone, so they don't gorge themselves on it as you switch bales.
And would you recommend like a slow feed hay net?
Yeah, slow feed hay nets are great for horses that are out on a round bale. Yeah, and then even in the stall, they're really useful, especially if they're in the stall quite a bit. If they're on layup for some reason, a slow feed hay net's great. So how does like routine veterinary care help prevent colic? Well, just having that once a year general physical exam, checking body condition, making sure there's no underlying things going on there is really important. You get a chance to have your vet around to just kind of evaluate and aid in any feeding practices or give new tips or new things that they learned that year in CE or whatever else, just chat about how things have been going. So that's a great opportunity. Routine dental work done is really important, as we kind of talked about earlier. Deworming horses is important. This year in particular has been horrendous for the small strongyle pathogens. So we have seen a ton of colitis related to the small strongyles. So encysted cyathostomes, they embed themselves in the large colon mucosa. And as they emerge in the spring, when the weather is perfect for them to be out on pasture, they cause a lot of damage to the gut and they get these horses really sick, febrile and diarrhea and all of that. And so making sure you have a good deworming protocol with your vet is important. And then of course, vaccination just for general health and preventing other illnesses that can then, predispose for colic because the horse is sick and not eating appropriately and then up in the stall. And so just keeping them healthy is important. And turns out that it will become important if you want to seek some colic care options as well. So the best advice for thinking about how to be prepared for the worst for a colic episode is to think about it and write it down, what you would do for your horses before you're ever faced with an acute colic episode where you're kind of put on the spot to make decisions like really quickly. Thinking about insurance options for your horse, whether or not you have a financial cap for your horse or horses, knowing what your transportation options are if you do need to go to a hospital, and then having at least a thermometer in the toolkit. So that way you have that first temperature reading before anybody gives Banamine or anyone puts their arm in your horse and will have a, that will make taking the temperature after that point a little bit inaccurate. So that's your main job, is to make sure you get that initial thermometer check and temperature check. There are good programs out there to help support owners and pay for some of the colic care that might be needed. And usually these are in for surgical reimbursements. They're usually not for medical colics. They usually require physical exams, dentals, vaccinations, and deworming be documented by your veterinarian. But they're really great. Oh gosh, my lights went off. It's like being kicked off stage at the Oscars, I think. But then there's other insurance options as well. Usually these platinum and colic care packages do mean that you have to buy their product. But if you're already buying their product, then definitely look into this. And then there's insurance options that you can talk to your different insurance companies about, and they range from major medical to surgical care and coverage only to mortality. Okay, so thinking about what things might make you not want to take your horse to surgery is basically remember that age is not associated with outcome. The type of lesion and duration of the lesion might affect prognosis. And this is something that you won't know, but the surgeon will tell you and advise you if the outlook does not look favorable for a good quality of life. If the horse has chronic colic multiple times a year, it might be that surgical intervention could fix that. But there's sometimes when there might be an underlying cause that can't be fixed surgically. And then if there's other diseases, so renal failure, laminitis, neurologic disease, where they're, weak and ataxic and then have a real risk for not being able to get up from anesthesia, those might be other reasons to kind of reassess your, if you would be willing to take your horse to surgery and what all that entails. Because all we're after, right, is for our horses to have a good quality of life, be able to do what they enjoy and what we enjoy doing with them. And so thinking about the whole picture is always important and something that we always take into consideration. Okay, this is our last myth, and I'm sorry, I'll get off quickly, but you don't need a referral to come to UGA. You can refer anytime yourself. And it's especially a good idea if your vet's not able to make it to you in time. So there's a more than 2-hour delay because it really does have an effect on the outcome. So if your horse's signs are very severe, then you need to really just get going this way or towards any hospital that has the option for surgery. So our takeaway points for today are that we know that colic is the most common equine emergency. There are prevention strategies that really are centered mostly on consistent good management practices and routine veterinary care. Both medical and surgical colic care is actually quite expensive, so have a plan ahead of time. It'll save you a lot of stress and strife. And the prognosis for horses that have surgical lesions is definitely improved by early recognition and prompt surgical treatment and correction. Those horses can really do great. And like Ashley pointed out, be running laps around everybody else that hasn't had surgery. So at this point, I'll take any questions, and I just thank you so much for tuning in tonight and listening to that. So happy to answer any questions.
That was perfect, Dr. Beasley.
Okay.
So we do have a question in the chat box. Lori asked about safe practices for minis and how much grazing is appropriate for new spring grass.
So that's a great question. And we're mostly worried about things like, getting laminitis when we're talking about going out on new spring grass. And it really depends on the underlying endocrine status of your horse. So if your horse is in good condition or a little bit underweight right now, then kind of easing out on the grass. Easing out on the grass, especially if you haven't had access to spring grass, is always a good idea. But if they're out on pasture all the time and they're in good body condition, not at risk for laminitis, they kind of get acclimated to it as it comes in. So it really depends on, is the mini a little bit on the overweight side already?
What mini is not overweight?
What mini is not? Oh,
Yeah, no.
Well, those that live in a dry lot.
Yeah,
That's a good question.
Exactly.
But yeah, and what's the age? Because certainly we worry more a little bit as they get older, but really any mini can founder. So you know, having a grazing muzzle is best to just have them on all day if you have one, because if you take it off, they will get there full of grass in a very short period of time. And so it kind of defeats the purpose of having the muzzle on. So honestly, keeping it on 24/7 when she's out on grass is ideal. And if you have a situation where you can have her up for some period of time, then yeah, definitely not underweight, good weight. So she's already out 12 to 14 hours a day. And if she's already in a muzzle or isn't in a muzzle, then it's time, you can definitely put a muzzle on at this point if she's already out on grass. But I think most places around here, our spring grasses come in.
Yes.
And, yeah, there's not a specific amount of time that's right. It's really if there's major changes in the grass with like a hard frost or you know, things that would affect the sugar production. So if she's already been out 12 to 14 hours a day and is in a good weight, then keeping her in a muzzle like from now on is probably a good way to maintain her there so she doesn't get overweight.
And our latest edition of the Leading Rein, we had an article about miniature horse care in there. So if you don't have the latest article of the Leading Rein, shoot me an email. I will go ahead and put it in the chat box, and I can get you on the listserv to get those.
Yeah, that's excellent. They are definitely a little challenge, but they're great. They're great pets, and they're so funny. I have a mini myself who is a little round right now and just put her muzzle back on her. So yes.
I have a miniature donkey, and so he is he gets zero feed concentrates, like just
air.
strictly air.
Air.
Yeah, air and water.
Air and water, right.
Yep.
Yeah. And she's the boss out there. She's with a big halflinger and a 17-hand thoroughbred, and she bosses those boys around. It's amazing.
Love it.
So,
well, does anybody else have any other questions for Dr. Beasley before we sign off tonight? All right. Hearing none. I greatly appreciate it. Thank you so much. This was definitely a very beneficial talk. And I agree, having a plan is definitely the first step in preparation, you know, making sure that you know your limits, know your financial bounds, and, you know, be able to make those decisions if, you know, an emergency ever happens. So thank you very much. And again, if anybody has questions, feel free to email me. Dr. Beasley's email was on there as well. Or like I said, you can email me and we can get in contact with her. So I appreciate it. And everyone else have a great night.
yes, absolutely. That's fine. Anytime. I'd love to see email questions if they arise. Guys, everyone take care and have a good rest of your week.
Bye.
Bye-bye. Thank you.